Okay. So I've discovered in this module that we don't cover all the things we could be covering on a newborn exam. So I may try to look at the computer and try to add in some things that are new we don't normally cover in our exams, but I may not end up covering all those. So that's kind of what's happening with the computer there. And normally we start off, just gonna say that I've already done the vitals on this baby. We do that and with the birthing parent, or if a family member is holding the baby, we do all the vitals there first before we move the baby to the table to do the exam. Okay, so baby's vitals were great. I'm just checking the head here and check the fontanelles to see if they're raised up or not. They're nice and flat and soft. I'm feeling the anterior and the posterior fontanelles. The head looks nice and symmetrical. Seeing a little tiny bit of molding, but I'm sure that'll be gone within the hour or so. The eyes, everything visually looks appropriately placed. Everything's pretty normal. I'm not seeing anything unusual. The ears are set properly with the eyes here. The nose looks symmetrical. Just gonna close off a nostril one at a time to see if the baby can breathe through the other nose. Nostril, make sure there's nothing stuffing her up right now. That looks good. Her eyes are nice and clear. I'm not seeing any kind of hemorrhage that can happen with the birth, so that's nice. We don't have to worry about any little red spots. Not seeing any little stork bites or little spots from the birth. The neck feels good. The clavicles, I'm just checking to make sure there wasn't any kind of injury there. We don't expect that. Sometimes some things can happen in the birth that you might expect that, but your birth went great, and that all feels good. Seeing full range of motion here. I'm going to check out some reflexes here. So the baby's grabbing my fingers perfectly here. That's good. Holding up their head a little bit as I lift them up. See if they get the little startle reflex here. So I'm going to drop the baby for a second here, but it's just to see if I get the Moro reflex, which is just a startle reflex. So you'll see that her arms are going to jump up in the air when I do this. So that's really good. Having her reflex, that just shows that no nerve damage. Everything's really nice through here. I'm feeling her abdomen. It's nice and soft. Nice and calm for me. I'm going to listen to all of the quadrants of the chest and make sure they're clear. Good. Feel for the rib cage and just listen right underneath that spot. Chest sounds good. I'm going to listen for abdominal sounds. Just hear little gurgling sounds. It's perfect. Okay. I'm just going to take a quick look at the computer here and see. Okay. All right. This actually isn't on our little chart, but this is always something we actually do, even though we don't. So we want to flip the baby over. And we're just checking to make sure that her spine is nice and straight, which it is. I'm not seeing any holes, any lesions, no little spots. Everything feels really good here. It's all fully formed. No dimple. But I'm just going to do like a little rubbing here, and just kind of checks if the anal sphincter is working. The little creases on the butt are even, so that kind of tells us that there's nothing weird going on with the hips. That looks good. while we have her on this side, we can see if she'll do the little stepping reflex, which is really cute. And then, okay, so we'll do a little genital check. We'll make sure she stays nice and warm. So we're just checking that, you know, we can check and see that her major labia are covering up the minor labia. She has all her little parts and pieces there. Everything looks normal. So it looks like she can go to the bathroom just fine, but we'll know she needs to go to the bathroom within the first 24 hours. So going, you know, peeing and pooping. She'll be passing meconium. That tells us, that's really the final answer, that everything's working there. Okay, so genitals look good. You know, her skin looks really good. I haven't seen any bruising anywhere as I've been looking. She's got really good color. She's getting good perfusion. It's a little bit of blue on the tips here, on the feet and the hands, but that's normal for the first day or so. It'll just take a little bit longer for her to fully transition and get fully oxygenated to all those extremities. She's got a nice alert state. She's nice and quiet and alert. She's a really good little baby here. She's got great tone in her muscles. She's keeping everything solid and flexed. I think the last thing I do the hips last and the mouth last. Skin and color looks good. All those reflexes we were doing helps us know that her nerves are all intact and everything's working well there. Oh, I'll do her measurements. The measurements are really just to give us a baseline to see how she's growing over the next several weeks here. There could be like it could tell us some other things if something was abnormal, but everything's normal here. So we do the head, we do the chest, right across the nipple line. And we do the length. So ideally, we'll make a little mark right there. Flex down the leg really good. Go to the heel. Get our length there. And then we can do the weight. The moment everybody's been waiting for, huh? This is a big, exciting time. All right, any guesses? No?
3 pounds.
I can't read that.
1 pound.
1 pound, exactly. Oh my gosh, you're a natural. Okay, so I saved the worst 2 things for last because baby doesn't like it. But they're both important things to look at. So first I'm going to check her mouth. So I'm gonna put my finger in and check that she's sucking. The sucking reflex is an important indication that her nerves are intact and that she's working. Everything's working well. And I'm also gonna push my finger down the back of her throat and make sure that she can gag, so that we know if she gets any mucus or anything, because she will be bringing up some mucus from the fluid from her lungs, that she can actually gag and choke that out instead of choking on it. And you'll know if you need to help her. So I'm going to reach in there and do those 2 things. And I'm just also feeling to make sure that her palate's intact up in there. I'm feeling all around, seeing if there's anything interesting in there. Like a little tooth or something. It's kind of unusual, but that could happen. Okay. And then the last thing we like to do is check her hips. We're really just looking at hip stability here. There's a couple different methods of checking to make sure that she doesn't have a dislocation here, or that they can't be easily dislocated. So one, her legs aren't real flexible, but you'd have your legs bent here, and you'd keep your fingers on the larger trochanter here, and you do a big rotation. The baby starts crying. It doesn't really hurt them, but they just hate this. They always cry. I've never had a baby not cry during this. And then we can also kind of push down against her to see if we hear any popping, any like clunking noise at the leg's coming out of its joint there. So she seems really good. Everything's perfect. I think that's it.